Hello, my name is Crescenze, and I'm presenting today on urologic hospitalizations in a contemporary cohort of SCI patients on behalf of the Neurogenic Bladder Research Group. I do not have any disclosures relevant to this work, and the funding for the study was through the Patient-Centered Outcomes Research Institute. Patients with spinal cord injury have a very high level of healthcare utilization. Upwards of 60% of SCI patients will require a readmission during the first year after injury. Unfortunately, the lifetime risk of hospitalization and ER visit continues to be high even after the first year, with about a 30% rate of hospitalization per year for subsequent years. The purpose of this work was to establish risk factors associated with hospitalizations and ER visits for urologic indications in an SCI cohort. This was a multi-center prospective observational study of SCI patients. It included patients greater than 18 years of age with traumatic injury and excluded anybody with progressive or congenital disease or malignancy. Outcomes measured included bladder management, and patients were divided into 4 bladder management groups, including volitional voiding, clean intermittent catheterization, indwelling catheters, suprapubic or urethral, and those who've had urologic surgery. Baseline clinical and demographic data, including validated questionnaires, were collected, and 1 year of follow-up data was obtained. All data was patient-recorded outcomes. There were 2,300 patients screened, and about 2,200 were eligible. Of those, 1,479 completed enrollment, and at 1 year, follow-up data was available for 1,260 patients. The median age of the cohort was 45, and 40% were female. Median time since injury was 11 years, and complete injury was noted in 39%. Majority of patients had an injury at T1 and below. Comorbidities were very common, with autonomic dysreflexia in 49% of patients, chronic pain in 69, severe bowel dysfunction in 41, and obesity in 20. In our cohort, 33% of patients had an hospitalization or an ER visit within 1 year of prospective follow-up. 50% of those were due to urologic indications, and 88% of those were due to infections. Here you can see that patients who were voiding had a 10% rate of an admission or an ER visit per year. Those on CIC had a 19% rate. Those who were managing with an indwelling catheter had a 36% rate of an ER visit or an admission. And finally, patients who had prior surgery or reconstruction had a 21% rate of an ER visit or an admission. We performed a logistic regression to better understand the risk factors for urologic-related hospitalizations or ER visits in this cohort. We found that patients with indwelling catheters had an odds ratio of 3.35 for an admission or an ER visit as compared to those who were voiding. We found that patients on CIC or those with bladder reconstruction had an odds ratio of 2.5 for an admission or an ER visit. Additionally, physical disability as measured by diminished hand function or SF-12 physical scores were associated with increased rate of urologic hospitalizations or ER visits, and unemployment was associated with a higher rate of hospitalization or an ER visit. In conclusion, all-cause SCI hospitalization rates remain unchanged over the last few decades, with about a 30% rate of admissions or ER visits per year. 50% of those are due to urologic indications, and most of them are due to infections. This indicates there is a lot of work left to do for us as urologists to improve the care of SCI patients. SCI patients with indwelling catheters have the highest rate of hospitalizations and ER visits, and this should be considered when bladder management is selected. And finally, bladder management, physical disability, diminished hand function, and unemployment are all risk factors for urologic-related hospitalizations. Thank you so much for your time.